Welcome to the Veteran Action Update Brief. I'm Mark Lucas, the founder of Veteran Action. Our guest is a great friend of mine, Darin Selnick. We both work together at Concerned Veterans for America. Darin also worked at the Department of Veterans Affairs for both President Bush and President Trump. Darin was instrumental in helping President Trump architect the Mission Act. This bill would give veterans choice in their health care. And recently, Darin worked as the Deputy Chief of Staff at the Pentagon. So, Darin, can you tell me about the status of the Mission Act and are veterans able to see real choice in their health care?
Well, I got to tell you, Mark, it's not good, unfortunately, and this has been the battle under Trump. When I was in the VA under Trump, we fixed 8 years of declining VA healthcare in the Obama administration with the Mission Act and accountability. So it's kind of sad to see under the Biden administration in the last 4 years that the whole thing's gone downhill. They have tried every trick in the book to stop veterans from having care because, frankly, veterans prefer the care in the community rather than at the VA. And look, if you're a veteran, to make it clear to your audience, if you're a veteran and earned your health care benefit, you should be able to get that benefit. Access should be timely, it should be close to home, and it should be the choice that's best for you. And so it's very unfortunate that the Biden administration has disregarded the Mission Act. It's disregarded its own regulations. It's done things like red team reports, telling how it's going to not allow veterans community care. And let me give you one small example of how this has affected a veteran. So I helped this last year a veteran in Louisiana, a blind veteran who had community care, and VA was trying to take the community care. Now, once again, this is a blind veteran, okay? They wanted him to drive over 60 minutes to the nearest VA facility, despite the fact that he's blind and old, and his wife is really elderly, and she can't see very well as either, but they didn't care. And so I interceded on behalf of this veteran, and we finally got him convinced. But that's how desperate they are to keep people in there. When they had a community provider that the veteran already liked, close to his home that he could get to, they would rather rip that out in the self-interest of their own institution to keep the veteran at the facility, even if that meant driving it and making it dangerous 60 minutes. That's how craziness that's going on.
Darin, we know that there's both good and bad VA hospitals, but also in the private sector, there's good and bad hospitals. Why is it so important that veterans have a choice?
Well, that's a good question. I actually get that asked a lot of time. Hey, Darin, is it true that VA has some good, some bad, and private sector? And that's all true. There's good, bad. But here's one difference. If you're in the private sector, like I am with my TRICARE system, and FEHB, if you're a federal employee, and even Social Security, even Medicaid, then if you have a bad choice, then you can change it. But if you're in the VA at the facility, they pick your doctor, they pick when you get your care, they pick how long the wait is, they pick your hospital, and if you say no, I want community care or I want something else, then they say too bad, you just don't get anything. Now, if you're in the private sector, if you don't like your doctor, you pick a different one. If you have a bad experience at the hospital, you pick a different one. If you don't like your plan, and that's the difference, because in the VA, the way they are trying to go back to pre-Trump, and the way they've been doing, then that's why choice is so important. So if your VA works for you, great, then you can stick with it. If VA doesn't work with you, that's the importance of choice and full choice that we're trying to get to, is that you always have the choice. Because here's what happens when you don't have full choice. You wait months and months for an appointment, and you have cancer, and then it's stage 4 and you're dead, sort of thing. I have a veteran that I helped over in Arkansas who needed residential substance abuse and treatment. And the VA said, hey, this guy needs to be placed immediately. Otherwise, he could harm himself, kill himself, suicide, whatever. But they said, we don't have an availability of a bed. So I'll tell you what we're going to do. It's going to be over 30 days before we can see this veteran. And there's a community provider available, but we don't want to see a community provider because we want to provide it. We don't have a bed available, so we'll give you an Uber to a homeless shelter. And you just wait at the homeless shelter until we have an opening. The veteran could be dead by that time, and yet you had a community care provider. And so a community care provider actually scholarshiped this veteran in so that they would not die, so they could get the treatment for their substance use. I mean, that's how crazy it is. Now, VA will say, well, we're a better Veterans prefer us. Well, there's statistics in the VA's own study, in their own budget. And one of those statistics is that when they surveyed veterans and their satisfaction, they had 83% rating of community care satisfaction. At the hospitals, they only had a 69%. They also did a research study that was published in JAMA last year, which said that for veterans who enrolled in private care, they were the most likely to get good outcomes and most likely to get bad outcomes if they enrolled only in VA. So, I mean, the studies prove it. But ultimately, going back to your original question, there are good VAs and there are bad VAs, and there are good private care and not. It should be up to the veteran to be able to pick and what's best for them. They know what's best for them, and that's why it's so important they have choice, because it can literally mean their life.
At Veteran Action, Darin, we believe in healthcare choice for vets. We believe that they earned it. And so I'm a little surprised that after President Trump's first term, you and I worked together along with many others to pass two historic reforms at the VA. The first was accountability. We wanted to be able to hold bad VA employees accountable. And the second was the Mission Act with choice. So what's happened since President Trump? Why do we have to pass the Veterans Access Act of 2025? I thought we fixed these problems.
Yeah, so did we. And then under COVID, they created these referral coordination teams. They literally did not follow the law. They literally testified that they weren't going to follow the law. And so a lot of the stuff in the Mission Act was put in regulation. And so we have a good VA team that's back under Trump too, but they still haven't got all their people confirmed. And they're a small team, and VHA is a little bit better than it was under Biden because they're a little bit scared. But there's nobody really managing it at this point. But the team will take control of it, and the team will eventually start righting the ship. But what we learned is that we can't just be under regulation, community care regulation. And the Mission Act directed a lot of these things to be under. We have to have it in the law so that we get it fixed, and we can't have another future Democrat administration undo it. And it makes it harder to undo it if it's all in law and not in regulation. For example, the Veterans Access Act of 2025 is really important. I helped provide some technical assistance on that. It was like, hey, what's all the stuff that they broke? And what else can we do to make sure that we put a fine point in the law so that even after Trump fixes it again, that it will stay permanent. So a couple of examples, access standards. Access standards are your guaranteed choice, which they've not been following and they've been gaming, but that was by regulation. This would actually put access standards in the law so they couldn't undo it through undoing the regulation. A couple other things that are in key in this, believe it or not, they don't tell veterans when they're eligible for community care. This law would make them tell veterans when they're eligible for community care. Also in terms of like best medical interest and the veteran's preference. Right now, as the bureaucrats do their preference, this would make them identify what the veteran's preference are in terms of community care or where they want to go and or a VA hospital and do that. Also, right now they deny veterans care and they never even let them know it. So veterans are like spinning their wheels and they don't even know. This would force them, not just in a regulation and policy, to go ahead and do an actual due process of denial. If the veteran thinks they should have had community care and they weren't allowed to, but this would put in the law that they would force them to go ahead and formally let them know that they've denied them and tell them of their rights in following the process. And then lastly is mental health. Right now, veterans are dying and suicides going up because they, like the example I gave earlier, they can't get the mental health. This would force them, if they needed mental health, residential mental health, this would force them to evaluate. And if they are suicidal, if they are identified as needing substance abuse or mental health now, they would have 48 hours to identify that and 48 hours to place them either at a VA facility or community care. So they would get their help, not an Uber to a homeless shelter, but they would get a real provider. If VA could provide, great, but if VA couldn't provide in 48 hours, to a community care provider, and they would have to stop the practice of sending them 1,000 miles or out here in California, hundreds of miles, and making them wait. And that's important because mental health and substance abuse is what is killing veterans these days because they're not getting the care that they need. So this is all critical. It's all critical we pass this so that not only will Trump fix it again and the good VA guys coming in fix it again, but it will be permanent. We need to make sure it's permanent.
Darin, what can people do who are sitting at home watching this to help us pass this Veterans Access Act?
Well, it's really important people get involved. And what I mean by involved is if you talk to senators and their staff, you talk to congressmen and staff, they're like, we didn't know people cared about that. We didn't know it was a problem. So that's why I always tell veterans if you have a problem in your district, they don't know unless you tell them. And they need their constituents because, DC is a political game. They all want to get reelected in 2 years. They need to know that the general public who vastly support veterans cares about veterans and their care and the service and what they've earned. And so they need to contact their congressman. They need to contact it. Doesn't matter if Republican, doesn't matter if Democrat, doesn't matter independent. You need to contact them and let them know that the Veterans Access Act 25 is important because veterans deserve to get timely care and not end up getting cancer and not getting treatment because delayed care is denied care. And we cannot have that. So this is critical. They need to contact their congressman, contact their senator, whether it's write letters, email, go to their office. You'd be surprised at how they count all that. So it's really critical that they do that so that once again, like Abraham Lincoln said, we can care for him who bore in the battle and for his widow and orphan. That is critically important. We need to take care of that problem.
And we absolutely need Congress to make this a priority.
Yep.
I understand there's a lot of work that needs to be done with the big, beautiful bill. And now with all these congressional Republicans who seem to want to rush to war with Iran, I think it's important that before we get engulfed in another war, that we take care of those men and women who've served before, that need to be seen by great providers, whether it's the VA or community care. So Veteran Action, we have built the Action Center where you can contact your lawmakers, just like Darin said. You can call them, you can email them, you can post at them on social media via the Veteran Action Center. You can do all three of those actions in less than 5 minutes. So Darin, I want to thank you so much. You've been a great friend for years. Very few people understand veteran health care and the challenges that we see back in our districts like you. And I want to thank you for joining the Veteran Action Update Brief.
Well, thanks for having me on. What you're doing is really important work. Keep it up.